Good. Welcome, everyone. And Lindsay, I see some folks may have joined in a Teams. If you or Bree,
I
can we?
I'm gonna pop over there and real
Okay,
quick. So I'm gonna turn my video off just a moment.
you just have to love when Zoom sends a Teams and a Zoom invitation that's so kind of Outlook, even though you didn't ask Outlook to do that. And I know there's a setting where you can turn that off, but I am not sophisticated with that yet. Well, welcome, everyone. Can everybody believe it's mid-August already? That we are closer to Christmas than we are at the beginning of the year.
Okay, Melissa, I think I got everyone who was over in that space, and I'll see if I can figure out and update that calendar invite so that's not on there. I definitely did not intentionally add that. I that is frustrating when that happens.
Yeah, Zoom is just our Outlook, just, they were doing extra double duty for you.
Indeed.
Understand. Well, we're
Well,
at right at 9. Do we want to
okay.
start live streaming and we'll go ahead
I
and get started?
I've got the live stream going. I will also hit record and then I'll let you take it over.
Okay, thank you. All right. Well, good morning. Welcome to the Early Childhood's Recommendation Panel. My name is Melissa Schoenberger. I serve as the Early Childhood System Specialist for the Kansas Children's Cabinet and Trust Fund, and I am also the chair of this recommendations group. So I am very privileged to be a part of everybody who is showing up and have spent some time outside over the last few days. So I will tell you, I am a little congested and apologize in advance. But it's the lovely, I say dog days of summer when it's windy and it's dry because I live in Western Kansas. And so allergies are all up in a roar. But we're not going to let that stop me today. Wanted to remind everybody that this is a remote meeting and that we ask that if panel members do engage, that they raise their hand and that when you do come off mute, you say your first and last name. And I like to also include your organization, just so that anybody listening to our live stream has an idea of who our panel members are. But as we get started with today, I really wanted to share a positive mind shift that I had yesterday. It was just a really feel good moment. My background is in childcare licensing and started out in the field. And then as I moved up, I spent less and less time, especially as the director of the field services, actually in the field. So when I needed a pick me up, and I would ask my staff and find a licensing specialist and say, hey, can I take along with you to a preschool? Because there's nothing like going into a preschool and having 3 and 4 year olds humble you and make you smile at the same time. I would love their energy of, hey, lady, what are you doing here today? And then one of my favorites is, rolling in our work bag and saying, hey, are you going to Las Vegas? I'm like, what? Where does a 3 year old know where Las Vegas is? But they just warmed my heart. And it would be such an adrenaline. And I was good to go for the next several months. So if you ever have an opportunity, go hang out with 3 and 4 year olds. They're the best. They are great conversationalists and they just really have a way of picking up your spirit. And I had that opportunity yesterday. So it was like such a great moment before the panel. I had the opportunity to be at the ribbon cutting of the accelerator facility in Manhattan. And it was to be a part of that crowd and to see where the community really worked together, and they started a vision. So really give out credit, and everybody else gave credit to one single person who started the conversation, and that was Miss Natalie Gordon. And Natalie Gordon used to be a member of the systems improvement team, which is a part of our early childhood governance. And Natalie asked a lot of questions, as she should. And she pushed back at the system and kept saying, what can we do differently for our community? And I love the story that they shared yesterday, where she met with two fellow members in the early childhood system, Casey Kyle and Melissa Bowles, and their conversation started over coffee. And now they had a groundbreaking of a just an amazing new facility in their community. And what I love about it, it really echoes the blueprint that we have within our strategic plan of really making sure families thrive. Because it's not just about childcare. It is about having the VOTEC partnership for education. It is also about having a free health clinic. So they're reducing barriers so families can be well. And it's also about making sure parents who are taking part of the child care services also are equipped to be a part of the workforce. So they're getting support to be a part of their community. And so it is holistically matches the blueprint that we have set forth with the All In for Kansas Kids. And when I was touring, I saw this. It was in one of the rooms because there's 8 incubator pods that were, it's just what's exciting is the accelerator grant through the children's cabinets was a major player part of this. So when I was in childcare licensing, I saw the blueprint, literally saw the blueprint. And then to see it all in motion and everything just come alive. And in one of the incubator pot spots, this is what greeted me, that today is a good day to start making a difference. And snapped a picture of it because that's the tone that I want to set for today's panel meeting, that we all have an opportunity to make a difference, not in just the greater state of Kansas, but in our own little world. And so totally, before you all joined us, shared with Lindsay that I am still very pumped up about my experience yesterday. And so I hope I bring that positive energy to today's meeting, and seeing what a coffee conversation can change a whole community. So really, again, looking forward to our conversation today, and anything that, as we go through the agenda, that you guys walk away with, that spark that I had. Lindsay, do you want to go to the next slide? Okay, so here is just today's agenda. And a quick walkthrough of what we're going to do. So we had our welcome and, my inspiration for the day. And then we're going to do some formal work of approving the August agenda and approving the July minutes. And then we're going to have the Kansas Open Forum, which we don't have anybody joining us in the Kansas Open Forum. So I just don't want that to be a dead space. So we're going to do something a little bit different. And if we don't have anybody in the Kansas Open Forum, we're going to talk about Kansas in the news. And so adding a new layer into the panel. And then we're going to do some introductions. Remember, 1 to 2 minutes if you're slated, because I think it's really important that anybody listening and your fellow panel members know who you are and where you represent. And then we're going to start talking about work groups and really digging into, putting the pieces of the puzzle together of where the panel sits, because we have the panel, but we have these really amazing work groups who are going to pull forth ideas and recommendations. And then we're going to have our partners join us to give system updates. And then I am very excited for the well-being pathway. This is an amazing project that the panel has been a part of, and you provided some early input, and now you really get to see the functioning side of it, and it's just feel good. It's just a feel good project, and you're going to see your communities on in there, and I cannot wait for you guys to see the well-being pathway. And then something directly that came out of our communications work group is key takeaways. So I'm going to share key takeaways from my perspective, and then I want to hear key takeaways that you learned from today, and then we'll add those to the notes, so that when you take any information that you learn, are excited about, like I was yesterday in the panel meeting, then you can start spreading and sharing the word within your own organizations and in your own space. And then we're going to adjourn, and we're going to have a great weekend. I know this is, for many communities, this is either kids have already gone back to school or they're gearing up. So lives are changing, and communities are busy. I live in Hayes. We have all of the Fort Hayes students coming back. So I am looking forward to getting on the streets of Hayes. We have lots of one-ways, and seeing the new students who have never set a foot in Hayes going down the one-ways wrong, and everybody's honking and everything. So I can't wait to get to adjourn and get on with my weekend, and hopefully not have my life flash in front of me as the weekend happens. But that's just the vibe in Kansas right now, right? Everything is changing and things are moving, and it's just a great time of year. So let's move on into our formal business. So we're going to go ahead and approve the August agenda. And if nobody has any additional items, I would ask that we have a motion to approve that agenda. Remember, if you come off mute, please state your first and last name.
This is
Abdul,
Audrey Wade. I'll move to approve the agenda.
Thank you, Audrey. May I have a second?
Abdul Yahya, Open Minds, I second.
Thank you. And may I have a thumbs up if all those are in favor of adopting the agenda? Thumbs up are raised hand. See lots of raised hands too. Thank you. And any opposed, same sign. Okay, thank you. Now we're going to move on to the approval of the July minutes. May I have somebody make a motion to approve our July minutes?
This is Cornelia Stevens. I make a motion to approve the July minutes.
Thank you, Cornelia. May I have a second?
Karen McCrory, I second the motion.
Thank you. May I have a sign of everybody approving? Great. Same sign for anybody opposed. Okay, great. Now we will move on to the heart of our agenda. Again, Kansas Open Forum. So anybody listening, or if you want to share with any of your neighbors, friends, family, coworkers, if anybody wants to join the panel and be a part of the open forum and share anything that is happening within their space, we have our open forum comments document and link. So please share it far and wide. But we don't have anybody joining us. So here's where we're going to add in the new addition to the Kansas in the News. So I receive a lot of newsletters, and I just do a lot of reading in general, and really want to find things that that really excite me, and I think would excite you. And but I'm always looking at it from a early childhood lens because that's the world we live in. And so I signed up for the HRSA newsletter. And then I had this come across my email last month. And I was really excited to see that they had put forth a cohort across the nation, and Kansas was a part of that cohort, where it looked at it's a stabilization program for rural hospitals. And the one that was chose in this first cohort was the Coffeyville Regional Medical Center. It's a 25-bed critical access hospital in Coffeyville, Kansas, which happens to be in Montgomery, Kansas. And the goal of the program, which is expected to take hospitals 18 to 24 months to complete, is to strengthen, rural healthcare delivery. And so immediately I thought to myself, why am I excited? Like, why is this important to the early child care system? And it was important because when you look at our strategic plan and you look directly in the pillar that it impacts children and families, you look and it states very clearly that they have access to healthcare. And if you don't have access to hospitals and you're in a rural community and you have an immediate need, then you're getting either you're getting flown away, or you're getting nice little ambulance drive. So immediately when I think of this, I think of a conversation I had several months ago with Christy Smith. And when she first became the executive director of CCA of Kansas, and really pushed her staff to say, when you see these type of programs standing up in our state, instead of waiting to ask for what can CCA do for me, it's cold calling and saying, what can CCA do for you? And so it takes a village. So I was thinking, what can we do for Coffeyville? Like, what does Coffeyville's hospital need what do they need to continue to stand this up? How can this be replicated with other rural communities? Because the first thing you're going to think about is always childcare. If I'm going to entice an ER physician to come to my community who has young children, they're going to ask, the first thing they're asked is, what does the childcare situation look like? What is my hospital support? And Kansas in the News, this segment of our panel is not to solve problems, but it's to cause us to think, broader and deeper of how we're supporting initiatives that are outside of the traditional EC systems. And this didn't come through an early childhood newsletter. It didn't come through the traditional channels, but continuing to support a hospital that is a critical access hospital is important in our states. So those are things that I want us to see and then challenge as you guys get into your work groups of how do we, support this space, and how do we make early childhood connections in areas that we don't normally think about. And so then I like to go down a rabbit hole. I'm like, oh, well, what else is happening in Kansas related to little people, right? Because that's our scope, is little people. And so really trying to understand, I'm like, what do pediatricians in our state look like? And so I wanted to know what does Kansas look like? Who is taking care of our little people? Who is making sure that they are getting health services? And so I went down and looked at a resource through the American Board of Pediatrics, which is a great visual when you're layering on other community supports. And Lindsay, I don't have access to link into that. So can we pull up that page? Okay, so if you go, it's a great document that speaks about, it's a great site that General Pediatricians US and County Map. So if you can go scroll down all the way, and then instead of picking Texas, can we pick Kansas? It's right down below where the Texas, yeah. And so you look at the desert of pediatricians, and it doesn't mean that in the counties that are white that there aren't other, family practice physicians there. But I always make note of it because I only have one child, but she had a lot of medical needs right from the onset. And I would have been lost without our pediatrician. And just the way pediatricians interact and really just love on children. And I will forever be grateful for our pediatrician, Dr. Buckles here in Hayes, who always calmed my daughter down because she carried this little black puppy with her everywhere. And he took a minute before he even engaged her, and he examined the puppy first so that he would, she felt safe in that room with him. And she carried that puppy. I'm not going to embarrass her because she's 23, and how many years they carried on that routine. And forever grateful for our pediatricians and for our community. We still only have 3. And now I realize, I wish I would have saw this, and it would have given me such a better understanding when they would say, Melissa, we can't get you in, but when they recognized it was an emergency and then you were prioritized to get in, and what they were doing shuffling. So I think really when you look at our blueprint in Kansas, again, talking about what I saw in Manhattan yesterday, getting access, healthcare, and what it means, and then specialized healthcare for our little ones, and the map that it shows. Not going to solve problems. And this is not intended and candid in the news, but I'm hoping that it sparks conversation in communities to understand, not just where our children are going for childcare, but who is taking care of our kids. So I didn't know this resource existed. We will make sure that you have access to it. But these are things when we are starting to talk about communities and their needs, and you start layering on all of these different facts, it really creates a different picture. And so Kansas in the News section is really to be a thought-provoking conversation with our partners and with you guys. So feedback, if you like this section, and if there are news articles that you see in a local level and you want to share, please send them to Lindsay and I in advance. And if you want to see anything else in this particular section, because this is your panel, please let us know. Christy, would you like to come off mute and share your comment, since we are following the Kansas Open Meetings Act and don't really want to use our chat, but I love your comment.
Sure. So it's interesting that you brought that up, because there's also been some discussions nationally with Child Care Aware of America and some others, Buffett Institute and Bipartisan Policy Center, that really are looking at the correlation between the shortages in childcare in those communities, along with the pediatrician shortages, and taking a look too at rural communities and urban, and seeing also the distance between where all those lie, again, in correlation between census data. So it's, I think, a bubbling up topic to see what all of the support systems that surround a child and how far it takes for a family to get from one to the other to the other. So I would say stay tuned, because I think that you're onto something, and it's starting to kind of bubble up some conversations nationally. So.
Well, I appreciate that because I truly believe Kansas is a trend-setting state. We have been in many buckets and will continue to move that way. And so I, again, appreciate, this spoke to me. I was poor Megan Cluth from that you're going to hear some systems update has had to hear me talk about this initiative over and over again, and was very excited to share it with the panel. And again, hope it sparks conversation as you guys get into your work groups. Brenda Bandy, I see you also dropped a comment in chat. Would you like to share that? Because I think everybody would like to hear what you shared about
Sure.
Coffeeville.
Thank you, Melissa. I'm Brenda Bandy with the Kansas Breastfeeding Coalition. And I pointed out that Coffeeville Regional, they're leading the way in maternity care as well. Even though they are a small hospital with few births, they are going above and beyond and have achieved the High Five for Mom and Baby Premier designation for their maternity care and breastfeeding support services. So I just wanted to continue the kudos to Coffeeville.
I did not know that. So see, we learned so much, and it's really as you later on in the agenda, your homework and your panel assignment was to really think about who you want to hear from, and sparked with me that maybe we want to invite Coffeeville and hear more about what they're doing to support our youngest Kansans and their families. So love that idea, and thank you for sharing both Brenda and Christy. But we will make sure you have access to that, again, the American Board of Pediatrics sites. And then we're going to go ahead and move on. Okay, so we're going to start what I call round one of panel introductions. Really, I want to get to know everybody. I always took pride in my previous occupation of knowing all of our licensing specialists, even if somebody worked in Johnson County all the way down to Liberal, and really want to get to know you as panelists. So don't be shocked as you move on if I actually do one-on-ones later on to get to know you on a different level outside of the recommendations panel. But I also want everybody who is joining us on our live stream to know who's represented it. So randomly picking a group over the next several months to share. So 1 to 2 minutes. And so we have on screen our first participants. I feel like Vanna asking from, are the Price is Right, like, come on down and join us and introduce yourself. And so we will first start with Nichelle Adams. Nichelle, if you would come off mute and say a few words about yourself.
I'm Nichelle Adams, or Nikki, and I'm with DCF. I am a deputy director. I oversee childcare assistance, food assistance, TANF, LEAP, Sunbucks, and a few other programs. And I am the co-CCDF administrator for the state of Kansas. I've been with DCF for 20 years. In the past, I have been a child care director, and I did home visits for a number of years, which that was very eye-opening. I was a teenage mother. I have children that have unique needs, and that's kind of who I am.
Melissa, you're muted.
Oh, I did not recognize that. Okay. I apologize. I just wanted to say Nikki wears many hats. And in our professional setting, I think Nikki has probably the longest title I have ever met. So Nikki, you just have to give everybody your formal title, because it is amazing.
It's Social Services Program Collaboration Deputy Director.
Yes. And always love when we're in a meeting and Nikki introduces herself, and Just again, appreciate that she's able to just without skipping a beat say that. But we're very lucky to have Nikki, so thank you. Tammy.
Hi, I am Tammy Benham. I'm currently working as a youth services consultant at Southeast Kansas Library System, and I have spent the last 10 years working in youth services in public libraries. Prior to that, I worked almost 20 years in a variety of capacities within the early childhood and early childhood special education systems throughout Kansas. Just to give you an idea of what I have undertaken in my current position, I work with libraries in a 15 county area in Southeast Kansas. And that looks like supporting library programming, services, outreach, collections, etc. This includes 82 staff at libraries in 41 school districts and staff at 60 public libraries. So I stay plenty busy. On a state level, I've been working to move forward play-based learning and early childhood best practices within the library field. And as part of these efforts for the past 4 years, the organization I work for, Southeast Kansas Library System, has administered the Family Play Spaces and Public Libraries Project, which is funded through CBCAP as administered by the Children's Cabinet. When thinking about the strategic plan, I think we fit in every aspect of it, and it was pretty eye-opening for me to consider where we fit within that. So thank you for the opportunity.
Thank you, Tammy. And again, love your nook. Kimberly Cervantes.
Hi, my name is Kimberly Cervantes. I also go by Kim. I work for KDHE in childcare licensing, and I've been there for about 3 years. My role there is the processing and monitoring manager, which is my team's work doing the new applications, renewal applications, issuing licenses. We also monitor the surveys that are done at the child care facilities by the licensing specialists and review those and then do continuous monitoring as needed and potentially enforcement if that becomes necessary. So there's a lot going on there. I personally, my career or pathway before the 3 years that I've been at KDHE, I have been a teacher of preschool children, well, not just preschool, but infants through preschool, and even some school age work. And I've also, the majority of my time's also been spent as a director of child care programs. So I've been doing working with children, well, long before I was 17 because I was babysitting and doing other things with friends or family, but been working with children pretty much my whole life. So this is my passion. So I appreciate the opportunity to be here.
And I can't wait till we get closer to football season. Kimberly has
Yay.
the most amazing Chiefs gear that she will wear on Fridays. And so I'm sure one panel will get to see these great earrings of hers. I miss seeing them. So it's good to see you, Kim.
Thanks, Melissa. You too.
Heather Faulkner.
Hi, I'm Heather Faulkner. I am in Hutchinson. I'm a mom to 4 boys. We have a little small hobby farm that my husband and I started. He's a colon cancer survivor, so we keep pretty busy in our off times. I have spent the last 25 years as executive director of a childcare center that is owned and operated by a church here locally that really just, they built a building 30 years ago and wanted to know how they could utilize their space to serve the community other than just having that building be used 2 days a week. And childcare was an issue 30 years ago. And so I oversaw that and administrated that for 25 years. And about post-COVID, I had our community foundation and United Way come to me and asked me to help put together a task force here in Reno County. It's called the Reno County Child Care Task Force. We've been working for about 3 years. City and county gave us about $6.1 million to try and address the child care issue here in Reno County. We leveraged that for another $2.5 million at the state with the Accelerator and Innovative Community Grants. And so for the first 2 years, I just did that and my other job. And then about a year ago, they hired me as a consultant to administrate the initiatives that we were doing and oversee that funding. Here just about 3 weeks ago, I was then hired. One of our initiatives was to create a sustainability model. As we all know, grant funding is going to run out. And so what does that look like long term? And so we are piloting a brand new organization called Kids Collective. It's a brand new 501c3 that I'm the executive director of that will be an umbrella organization for childcare providers here in Reno County to try and bring down the overhead admin cost and shorten that gap between the cost of care difference that providers are losing and is hard to charge to parents. And so that opens September 1. We're piloting it with the center I ran for 25 years and Bueller USD 313. And within the next year, we will have 2 more school districts underneath that umbrella, along with a couple of others. And so lots of things going on in Reno County, trying to address a very complex, challenging issue on multiple fronts. And so I'm excited to be more connected with things that are happening outside of Reno County. We are definitely a group that doesn't want to recreate the wheel, but wants to work collaboratively with the other entities working. So that's currently what I'm doing.
Well, you exhausted me, Heather. You're very busy, so we can't wait to hear more and have your insights from Reno County into our panel. So thank you. Holly.
Hi, everyone. I'm Holly Fry, and I'm a home visiting program consultant at Kansas Department of Health and Environment and the Bureau of Family Health. And I've been in this role for about a year, and prior to that, worked with our overall maternal and child health program for a couple more years. And then prior to that, worked with some of our Bureau of Health Promotion programs for about 9 years. So about 12 years in total with Kansas Department of Health and Environment, and I am in Topeka. I'm also a co-director of the State Home Visiting Leadership Group with Lisa Williams, and am a member of our Kansas Maternal and Child Health Council, which both of those kind of connect. I think there's a model you shared at one of the past meetings that really showed these different groups and how they connect. So there's some connections there. And then on a personal level, I'm mom to one 10-year-old who just started school. So I am feeling that kind of change in my life and in the community, and a little element of more busy, it feels like. But that's me, and it's good to be here.
Thank you, Holly. And I want to make sure I'm saying, is it Talia?
Talia.
Talia.
Yes. Hello, everyone. I'm Talia Juliana Myers with Child Care Aware of Eastern Kansas, and we have a 33 county coverage for our region. So whenever me and Christy are talking, we have to kind of scale back on what we're using for regions and things like that. I am the provider service manager. And what we do mainly is we focus on helping communities address the need for childcare within their community. We understand that all communities might have a different need. We also help families find childcare. And then, of course, we work with our educators to help increase quality. And so I've been a part of the childcare resource and referral field in some realm or element for the last 16 years. So I've seen the trends come, I've seen them change, I've seen things, move in the good and move in the bad. So I'm just happy to be a part of this group and be able to provide my insight on the childcare field.
Thank you. And Larry Lewis had to step away, and so we're going to move on to Trina.
Good morning, everybody. I'm Trina Morgan, and I currently am the Director of Program Development and Training at Kansas Children's Service League. We are a statewide nonprofit working in child abuse prevention. And so I came to KCSL 7 years ago after working for several decades in early childhood programming in various ways. And now I work pretty exclusively on systems, both in our agency as well as external. And then this year, training came under me. So the governor's conference, which is coming up in October and registration went live last week, is now under my responsibility. So I'm very busy right now with that. Personally, I have two adult sons, both with disabilities, who I adopted from foster care in another state. And then we moved home. Once I had my boys, we're moving home to be with to live closer to grandma and grandpa. So that's what brought me back to Kansas. And they are an absolute joy, both 25. One's at work right now. So, we have a busy household. I will warn everybody, I had surgery on Wednesday on my ankle. So I am a little, I'm here, but yeah, I'm still a little bit in the what have I done? And how am I going to make it a month without being able to walk? So, but I'm so glad to have this today. This was something I was really looking forward to. I'm excited to be on the panel, and I'm excited to be able to further KCSL's abuse prevention in a lot of different ways. So that's me.
Rena, we will get the link out to all of our members. If you went live, we'll make sure everybody has the link to the conference, because it's a great conference. So definitely would love to share that. And good luck over the next month. It's a good thing this is a remote meeting and you can just sit. So Natalie.
Hi, I'm Natalie Salo. I am a pediatrician, recently retired from KU Wichita. And I trained a lot of those pediatricians that were on your map earlier. So that's kind of cool to see. So in my role as a pediatrician, I got to see a lot of kids and families who were really struggling with childcare. I also saw a lot of kids who were not ready for kindergarten when they came in for their checkup. So that really hit my heart. I am personally a mother and a grandmother. I have my 5-year-old granddaughter here with me today. So, it's those gaps in the childcare right before school starts. But anyway, because of that, I've really been able to listen to my children talk about how difficult it is in Wichita to find affordable childcare. And everybody I talk to uses the word crisis over and over, different people. So I'm just interested to see what is being done across the state to address that. I'm also a board member of Center City Academy. We're working to build a early childhood center in downtown Wichita and to try to address that need. But I've been looking at it from a lot of different directions. So I'm just really honored to be on the panel.
Well, we are honored to have you, Natalie. And I see, you just feel like everybody's just connected by just a small thread, right? And seeing that today and hearing your connection to our Kansas news solidifies in my heart why those things are important. So I appreciate your comments and hope you have a fun-filled afternoon planned with your 5-year-old granddaughter. Christy.
Hi, everyone. I'm Christy Smith, Executive Director of Child Care Aware of Kansas. My background's just been with a variety of elements in the system, but I would say always until most recent was really siloed. So before and after school care, center director, I was a CACIP, a corporate trainer and monitor, and then I was a district manager, workforce development, health and wellness, you name it. They were all like these siloed things until I started my journey with family preservation. And that's really where I saw how our programs and our services, while great and have all great intention, really were not a connection to families. They didn't fit into a larger system. And it's really where I first discovered, wow, we have amazing things, but we're really not meeting families and children with where they're at. And how do we really focus more on the systems building, which is truly where my passion is. I love to create light bulb moments, whether it's helping people discover their strengths or a team that is like, wow, I just didn't even think this was possible. So I love connecting people and ideas, processes that spark maybe meaningful change. My team will tell you that I reference all the time that we're barrier busters and we have to flip our switch from saying no to a not yet and figure out what are maybe the steps to help a community or children or families get to the level that they really want to be. And that's really where I think my strength is that I bring to Child Care Aware of Kansas. And I love fail forward moments. Those are just reminders that we're not there yet. We have to figure out what works and what connects. And more importantly, we're one step closer to finding a variety of solutions that work for the problem that we're trying to solve. So just super excited to be part of curiosity and learning and growing myself. So thanks for having me.
Thank you, Christy. Audrey.
Audrey Wade, and I am an attorney. I worked for 11 years in healthcare compliance and full time. So, and now in the of a 6-county. Our main office is in Clay Center. We offer early Head Start childcare partnerships, and frankly, because it partners for our families, we opened our own room for under the Kansas partnership so that we could serve some of our families in Clay Center. And then so that we could open another early Head Start classroom for those young kiddos, for our families that can't find childcare. We also have a Head Start preschool in 4
Audrey, I think we're having some connectivity difficulties with you.
You know what? I think it's my left AirPod. Is it better now?
Yes.
Okay. Do I need to start over or was it enough?
You may want to if you could yeah,
Okay.
if you don't mind, because we were hearing like every other word. So
okay. Well, then I'll start over. My name is Audrey Wade. I live in Clay Center. I'm the executive director at Little Learners Childhood Connections. We are a 5-county or 6-county Head Start program. My background is actually as an attorney in healthcare compliance. After COVID, I didn't want to go back full time to the office in Salina. So I stayed in Clay Center and then got this position with Little Learners. We're fully grant funded. We have the Kansas Early Head Start Home Base Grant, the Kansas Early Head Start Childcare Partnership Grant, and a federal Head Start grant. So with our childcare partnership grant, we found that it was difficult to find childcare providers who would partner with us, and ended up opening our own classroom in Clay Center, which is our largest city, because almost all of our service area is rural. So we serve Clay, Cloud, Ottawa, Republic, and Washington counties. And we recently added Gary County for our home base, and it's home base services only. We have Head Start preschools in 4 of our 6 counties that we serve. We did a change in scope on our federal grant to open an early Head Start classroom in Clay Center. So Clay Center got one of the accelerator grants, and we'll have one of the childcare rooms there. Just because childcare is hard for anyone to find in our state, but it is particularly difficult for people who live in poverty to get good childcare. And the early Head Start classrooms are for those 0 to 3. It's free to the families. It gives them an opportunity to be able to get out and work. So that's what we're doing. I'm also the Clay Center Municipal Court Judge, so kind of focus on teen drinking and smoking. Like those are some of the things that I would see in terms of children.
So you have
And
the
that's
full
me.
gamut from birth to teenage.
Yes.
And so I appreciate that lens. So,
Yes.
And thank you for bearing with us. And with you got to love technology sometimes. I've been dealing with my microphone for the last 2 weeks, so I definitely understand. So, well, thank you. This was our first round of panel introductions. We'll have some more next month when we all get together. So now we're going to move into really the heart of your panel assignment and work group overviews. As we get into the work group overviews, I want to first thank any panel member that was a previous panel member and carried over to do the introductions. I want to call this like speed dating. Why do you want to go out with me? For the panel members to really elicit interest into the different work groups, because we have a 50-50 returning panel members and new panel members. Remember, or just a reminder that previous panel members, you're not sold or tied to your previous work groups. If you felt like you did a great job and put all of your energy for a year into one work group, but now you want to join another work group, you have the ability at this time to do that. And so really be mindful of that as you listen to the introductions. But next slide, please. So again, we're going to really focus in on the, we asked you to look at the strategic plan. Hope you spent some time really reviewing that, because that is our guidepost for the work that we do within the recommendations panel. And then really wanted you to think about, what do you as panel members want us to bring to you to learn about and to know within the system? And then hopefully you have some ideas to share. And then again, we're going to talk about the panel, the different work groups. Next slide. So again, this is a gentle reminder of the strategic plan overview, because I'm sure there's probably one or two of us who did not have time because we've been really busy to get into the strategic plan, but really wanted to remind you that, again, these are our three pillars: our ecosystem, our workforce, and our children and families. So that'll be in your slide deck to always reference. Next slide, please. So this is when I want you guys to be engaged in this section of the meeting. I asked you for what topic or areas of focus would you like to hear from. So please, this is intended to be interactive, and what governance groups or organizations. So I would ask that you come off mute and share with Lindsay and I, so that we make sure that we're meeting your needs. So is there anybody that you would like, or any specific area of topic that you would like for us to arrange to be a part of this recommendations panel? So I'm just going to pause and quit talking and let you come off a mute and share ideas with all of us. Karen.
Hi, Karen McCrory, Mitchell County Partnership for Children. I am very interested in Pillar One, our ecosystem and infrastructure, and would like to see if we could work on statewide our ASQ database system. I find in the 5 counties that we serve that health departments use a family access link, then early childhood block grant programs use a access link, and then of course kindergarten snapshot uses a different access link. And I find that parents often struggle with, wait a minute, which link am I using, and well, I already did one at the health department, and those systems don't seem to be working very well together. So it's something I would really like to see if we could address.
Okay. What might be helpful for all of the panel members is to have an ASQ overview to understand the different systems. So, and we have a connection on our panel with KSDE, so I think we can make that happen. Love that idea. Any other suggestions?
So
Audrey.
I am particularly interested in pillar 3, especially I think it's the goal 3 and 4. So the full range of services to improve child well-being and then prioritizing mental health. Um, I'd like to hear someone talking about dental care for children, especially children who don't have insurance. And then I always think prioritizing mental health is a good idea for children and families. So anyone who would talk on that would be good.
I appreciate that, and it falls through what we talked about with healthcare. So love that idea. We will add to that. Heather, I think I saw your hand up first.
For me, I think the one that is most stands out to me is the workforce pillar. Through the last couple of years when we started this work, advocating around our dollars that we needed to prop up the workforce and the workforce pipeline was not as well received to allow us to put funding towards. And so it was more just get slots open. And so we have north of 500 slots and no workforce. And so I am really interested in that. And one of the areas I think could be fun to maybe look into is that old wages system that the state did years and years ago around workforce and that extra kind of support to that workforce. Are there ways and means in which we could restart a program similar to that?
I appreciate that. And I think what we're doing is segueing in and instilling some of the thunder of the work group overviews, which is workforce is one of them. And Heather, I think you would be, I already see where you're going to want to join that work group. So love those nuggets. So what we're really looking at is like, is there anything also, any entity that you guys would like us to bring our governance group but Heather, you got me excited about your workforce group. Like, oh, that's a great idea to add to the workforce group. So wrote that down. But going through and I do not want to misstate your name. So and
it's Shira.
Shira, thank you.
Yep.
You knew who I was going for. Yeah,
I've been getting that
Shira.
since kindergarten, so it's okay.
Okay, so Shira, I saw your hand up next, and then Tabitha.
I'm really interested in pillar 1. I think talking about the ASQ and just strengthening the relationships between the private sector and the public sector, coming from a public school district, and how we can better form those partnerships and work together. We do the ASQ in our district. I would like to be able to help the child care centers and the family home providers in our community also start doing that ASQ, because the information is valuable for my EC teachers, but also as kiddos transition to kindergarten.
Okay, I have ASQ down twice, so I think that is going to be definitely a hot topic. And thank you, Shira, for helping me with your name. I appreciate that. And then Tabitha, and then Brenda, and then we will move on to the speed dating with our work groups. Tabitha.
My internet's being a little sketchy, so if I freeze, I will stop talking and carry on when it corrects. I work for Kansas Parent Information Resource Center, KPERC, and it is our job to help build capacity for family engagement in our state. And my specialty is in early childhood, and we have some early childhood family engagement standards. And we have really there's an effort this year on my part to really champion those. And so we have created a survey that is specific to those standards that I would love to share with the group that they can share with their families in any kind of program, public school or private that you're in, that will, help us understand where the needs are in family engagement, but also help your childcare programs understand that. So that is something I would love to bring to the board this year.
I wrote that down. Tabitha, you will definitely be one of somebody will be reaching out to. Brenda.
Thank you. Brenda Bandy with the Kansas Breastfeeding Coalition. And I'm particularly interested in Pillar 1, the ecosystem, and Goal 5. There are two parts in there. One is, and I have the numbers here, 5.8 around maximizing use of Medicaid. We've long been interested in that role of ensuring the health and well-being of children ages birth to 5. The second is 5.2 around economic stability. And I really appreciate the shout out, especially lower or further on in the strategic plan for paid family leave. We know that this can be a solution for our state, and there is a statewide coalition that has taken this issue on. So I just wanted to shout out Medicaid and paid family leave. Thank you.
Thank you. Okay, so what we are going to do is move on into our work groups. And then if we could we have 5 active work groups for the 2025-2026 panel year. We have the family-friendly workplaces, mental health supports, targeted journey recruitment, systems, progress communications, and ECE collaboration, which is brand new. And what we're going, what they illustrate is that they make up, they're all pieces of the panel, but they're all unique, similar to a puzzle. As you can see, I love visuals. And what we're going to ask is we had volunteers if they can share 1 to 2 minutes of what they've done over the last year, and to really sort of get you excited to what you want to see in the next, where you will be joining in your work group. And then following this meeting, there will be an opportunity for you to partake in a survey that you will pick what work group that you really want to join. So we're going to start with family-friendly workplaces. If we can go to that slide. And Melissa Martin is going to give us a 1 to 2 minute overview of why you should join their family-friendly workplaces.
Hi, everyone. I'm Melissa Martin with Sparkquill. Over the 24-25 year, and since this work group's inception, our intent has been to create a strong family-friendly workplaces designation for Kansas. And that actually touches aspects of all 3 pillars of our plan. It recognizes the importance of a comprehensive family-friendly workplace designation that supports the interests and needs of Kansas families and businesses, so that both the state economy and the well-being of children and families is strengthened. So as part of this, we researched several states and Australia's family-friendly workplace designation. And when I say researched, I mean we had meetings with the folks from those organizations. They shared copious amounts of materials with us. And so it was really beneficial. We got a lot of lessons learned and a lot of really great insight into the process of creating a designation. We took what we believed were the strongest pieces from all of those organizations to create a suggested framework for Kansas. And what we found most important for the framework was a structured application with a fee, tiered recognition, that employee voice must be included, that there are no cost resources, that there is a renewal cycle, and then we divided the the effort into 4 policy domains. So leave, health support, work schedules, and economic support. I think a critical conclusion from the previous year is that we believe that a neutral organization outside of a state agency would be the best entity to manage a family-friendly workplaces designation. So opportunities for the coming year. Certainly still have work to be done. The next steps that we've identified are to find a home for the designation, to formalize an advisory board and charter, to develop survey instruments and scoring rubrics, to create a fee structure and fee waiver process, and then to finalize the criteria for the tiers of designation. And beyond that, we're a fun group of really nice people. So.
Thank you, Melissa. And can't wait for myself to join some of your conversations. Thank you for that overview. And now Megan Cluth is going to give of why you should join mental health supports.
Good morning, I'm Megan Cluth. I work for the University of Kansas Center for Public Partnerships and Research. So I'm not officially a panel member, but I was helped support some of the work toward the end of last year for this work group. And with some of the turnover of panel members, I'm going to step in as the chair, but would love to have some of you all join the conversation. And I think there's an opportunity for some leadership here if you're interested in that. So the mental health supports work group is mostly focused on the mental health needs of the early childhood workforce, and that is like all sectors of the early childhood workforce, though I think we've seen like opportunities for overlap with the mental health needs of families and young children, just knowing how interconnected all of those things are. So this work group, I think we obviously mental health has been a growing conversation in our system as well as nationally. And so it was started recognizing that. And I think really the timing couldn't be better. While this is not a new conversation in Kansas, there's just been a lot of momentum. And I think there are quite a few reasons for that. One being Kansas's preschool development grant has mental health needs of kids, families, and our workforce is a pretty big focus area. And so there's been an infusion of dollars and capacity to work on this, as well as some other groups that I think are really just kind of seizing the moment. So some of the things that the group worked on over the past year was really developing a list of system needs. I think mental health supports is like kind of an overwhelming topic, and it's a little bit hard to know where to get started. But the group created a great list of like trainings, resources, like just connection points across the system, and really trying to understand like what do different sectors of our early childhood workforce need to support their mental health and be equipped to support the mental health needs of kids in care. They also, this is how I came into the picture, looked at connections through the preschool development grant, through CAME and other groups that have been doing this work for a long time. There's also a nice opportunity with kind of more the formal mental health system, with just some requirements that have come into place in terms of community mental health centers supporting early childhood needs, and some work around how do they make sure that they really understand. There's a lot of nuances to mental health support for young kids and their families and our workforce. So that's kind of how we got here. I think in terms of what opportunities for the next year, there's going to be an in-person early childhood mental health convening in Topeka on October 15th. I'm really excited to say I think we're up to almost 60 people already. And that's really like bringing together people from early childhood, mental health systems, maternal child health systems, child well-being, healthcare in general, like anybody with an interest in how to support early childhood mental health needs, regardless of who their kind of audience is. That might be parents, kids, professionals, et cetera, to really come together and say, like, this is such a big topic. What do we feel like the biggest needs are? How can people feel like they're connected and not having to solve all the problems? And that there are supports available. So my hope is that that event will really help inform some of the opportunities for this work group to say, like, what are specific projects that could be done by this work group? Where is there data that the group could really decide what they want to do? So one part of that convening is we're looking at creating a workforce mental health survey. There's actually been quite a bit of data collected around this in the past years, and so our team at CPPR is like kind of pulling that together and figuring out, like, what do we still not know about the mental health needs of childcare professionals, home visitors, different segments of our workforce, and so that data may also be like a place for the group to be able to kind of look at, like, okay, here's what we're seeing, here's what we want to do. So I think there's a real opportunity for the group to decide what comes next. Also, as part of PDG, there will be over the next year a early childhood mental health gap analysis. So this is the goal of this is we know that there are big mental health needs, but like drilling down to, like, what does that look like in Northwest Kansas versus Southeast Kansas? What does that look like for families with kids who have different types of needs? What does that look for different populations? How does the workforce feel like they're getting their needs met? Like, really, like, getting into the specifics. So I think there's also going to be an opportunity for this group to kind of help follow along and help inform and really make sure are we asking the right questions? Are we talking to the right people? Are we making sure we're being, like, representative geographically? All of that. And then lastly, I think just, like, how do we take what we're learning and there's a lot of really good existing content in the system and make sure we're getting it out into the hands of the workforce and to families. I think there's a lot of opportunities for overlap with that. So things like, I mean, I've had conversations with some of the partners doing this work who were like, how do I make like a 60-second social media video that we can send to providers of, like, hey, here's like one way to interact with kids in like a way that's like really a mental health best practice, or here's like some resilience practices for your own staff. So things like that. So I know that was a lot, but the point is I think there's a lot of opportunity, and I think there's going to be data available, and there's a good foundation. This is not starting from scratch, but I think there's going to be a lot of the group can really help decide, like, what feels like the most impactful and meaningful work for the next few months. So I would love to have you join me on that and see what we can do to really address mental health needs. Thank you.
Thank you, Megan. There is a lot of work, and so excited for your group too. The next one is Amy with Targeted Journey Recruitment.
Hi, I'm Amy Gottschammer. I'm the owner and executive director for Googles of Learning in Lawrence. And I have actually been focused on this work group for 2 years now. And so I am stepping away as the chair. So there is definitely an opportunity for leadership here. I do want to continue to participate in it and bring whatever historical knowledge I have with me. But I'm not in a position this year to continue on in the leadership role. So we'll definitely be looking for somebody that is willing and able to step up, but I'm happy to support. So what we've done so far, and I've mentioned a lot of this, for the 50% of you that were here at the end of the year, this is just the brief review, that we did a lot of work on just kind of determining what it was that caused people to not be interested in entering the field or staying in the field. And so we took that information that we gathered and we put a lot of it up on the All In for Kansas Kids website. And so you can see that some of the general areas that we came up with above and beyond pay and compensation packages, right? Benefits and wages. Beyond that, people were concerned about the feeling respected. We wanted to change the public perception. The other thing we want to do is invest in growth, because people need to feel that there's an opportunity to improve their pride in themselves professionally. They want more job satisfaction. They also feel the need, as we just heard, to prioritize mental health. And they, especially those that are owning their own businesses, right? Those small centers and home providers need small business skills. So we need to strengthen those small business owners, because though they are operating schools, they are still operating a small business and they need those supports. So those were the things that we thought were something that were within our wheelhouse that we could look at. And so the website shows a lot of different strategies and opportunities for people to possibly engage in that might help support them. And it's targeted towards different audiences. So it's providers, it's communities, it's agencies. So anybody can look on that website as a different entity and say, oh, this is a way that we can help our community, or I can help myself, or I can help my school, and focus on those different areas that they think they might need help in. So one of the things that we started that in the first year. The second year we continued to change, update, eliminate dead links, things like that. But I think it's a dynamic website, and so I think it's a place that you would continue to want to examine. So, and like I said, I was just exploring those barriers for professionals. Why don't they want to enter the field, and why do they leave? So going forward, though, one of the things that we really started to target last year was the people that are entering, the recruitment aspect of it. And we started just down at that high school level. We said, what is happening? What are we trying to do? And why isn't it working as well? And so we thought there was a bit of a disconnect between the high schoolers, what we're doing to encourage them. We've got some great programs in the schools, but there's a barrier. They're hitting a barrier that we found, that they're not necessarily ready when they leave high school to enter the workforce. They've got a lot of great education that's happening in the schools. And when they go on to college, that part is translating. They're getting some hours that are recognized when they go on to the higher ed, but it isn't necessarily recognized by KDHE. So if they leave high school and go directly to the workforce, there's a disconnect. So they're not really workforce ready. And that's something that we wanted to look into more in this coming year. We didn't really get a chance to go too far with it in the second year last year. So we'd like to explore that a little bit more. Some of it was just a thought of maybe we could survey some of the current USDs that are offering ECE programs and saying, hey, here are the requirements for KDHE. What are you guys doing within the school? What are your kiddos leaving with that, and how does that meet the mark as far as what KDHE requires? Are they getting foundations or some equivalent? Do they have first aid and CPR? Do they have a TB test? Whatever it might be, but are they meeting those minimum requirements for KDHE to enter the workforce? So are they really ready, or are they just going to hit a barrier when they try to go out and get their first job? And then there's a little bit of a component where we talked about paras and how we find that at least in several communities that paras are typically somebody that wants to get into early childhood when they're on breaks from working in the school district. So there's a crossover between working for KSDE and working for KDHE. This population of people work with kids, right? And so in the summers, we get them wanting to work for us, spring break and winter break and things like that. But yet the requirements they meet for KSDE don't meet the KDHE requirements. There's just not a lot of alignment there. So they come to us, and then all of a sudden they have to take an 18-hour class, and they have to get re-fingerprinted, and they have to do these other things. So we're looking to try to align the requirements to make things easier, so there's not as much of a barrier, so that we can recruit more easily. So, and then again, with all of the new work we just did on the career pathway and the new KELs and the new core competencies, trying to make sure that everybody comes in with that knowledge ahead of time, so that they can get their IPDPs done and they've got their goals set, and then as the directors of these programs, we can help support them right out of the box and making sure that they feel like they've got the the professional support that they need, the professional development that the directors can help guide them towards. So that's kind of where we're going right now, is trying to kind of start at that real early recruitment phase to make sure they don't hit a barrier right out of the gate. So if anybody's interested in working with us on that, we would welcome that, and especially if anybody's feeling like putting on their leadership pants, that would be great.
Thank you, Amy. And then last but not least, we have our additional new Oh, no, I'm sorry. I jumped ahead. We have 2 to go. So, Maritas, if you want to give us a brief overview of the system progress communications.
Thank you, Melissa. I'd like to acknowledge and say thank you to the members of this group. First, Nichelle Adams from DCF, Kelly Franz Langford from the Infant Toddler Services provided by TARC, Mandiwa Child Start, Heather, I can't pronounce her last name, but I'll give it my best shot. Was it Schrottberger from Kansas Head Start, Lisa Gearing from USD 270, Sheila Bertelson from USD 443, and Christy Smith from Child Care Aware. And any of my team members who are at this meeting may add to what I am going to report today. So our group distributed surveys to key contacts across various early childhood work groups, and responses were coming in. These responses are helping us verify and compile information about each group's mission, the role within the early childhood system, and how they communicate both internally and externally. And our goal is to better understand how each group functions and connects within the broader system. And the information will support our efforts to identify opportunities for stronger coordination and improved communication across early childhood at work groups. We have developed a draft system communication guide in the SharePoint folder, and was recommending that the systems communication work group continue to finalize the guide, establish a process for sharing and maintaining it, and determining a permanent home for it. However, on the other hand, a couple of us were thinking that with the establishment of the Kansas Office of Early Childhood through House Bill 2025, which will consolidate early childhood education and child and care programs into a single state agency, our communication system will likely be impacted, and whether this group is the right one to take on this work. Having said that, we invite you to join this work group and help review what we have done and shape the next steps. I welcome any comments from my other team members on this topic, if there are any additions.
Not hearing any, Maritas. I appreciate your communication, and I echo your sentiments that this will be a year to make sure that we are all very well informed. So I appreciate your systems group looking at that. And then last but not least, our new committee, and we have asked Christy Smith to give a brief presentation.
Thanks, Melissa. So as Melissa said, this is a new work group, and we have really truly been given a blank canvas to really think big, dream big, be powerful together. And I would say, remember when I said earlier, if you all were listening, about being a barrier buster, that's really where I see that this team can support some of these efforts, remembering how to kind of link those systems together and lift up and really synthesize and synchronize all the work that's being done throughout Kansas. So if you're a big thinker, you like to think big, you really want to see the future, if you've ever sparked curiosity by asking, what if we could? This would be the perfect work group to join to make it happen. Really, it's a hub for system thinking. So again, connecting the dots between the existing programs, maybe even where the funding streams are, what the community needs are, looking again for those additional opportunities. It's just going to be taking a look again at big picture. So I would say the best fit for the members of this group are individuals who aren't necessarily focused on a program or an organization, but really want to look at it from a cross-sector perspective and think about maybe those voices who aren't at the table. And as KLC language would go, get in the balcony and maybe see who isn't holding the hands on the dance floor. But would love you to join you and kind of help shape this work group and trying to figure out where our goals are as we move forward.
I love that visual, Christy. The next time I'm going to look and see who is not holding hands. So yeah, love that. Thank you. So at our next panel meeting, prior to that, we ask that you complete a survey, which the survey will ask which work group you're most interested in, and then if you're willing to serve in a leadership role within that work group, because there has to be a group, a leader within each group to help shepherd the meetings, making sure that notes are being taken. And we will have a very specific document for you to capture so that we can continuously monitor and see where work is going and where we can be the most of assistance to our work groups. And in the September 19th meeting, part of our meeting will be I know there's a traditional, you take a break, you have your work groups afterwards, but we are going to specifically allow time within the meeting for you guys to begin your work group conversations. So thank you to everybody. I want to join all of them. So I'm glad I'm the chair. So I have the privilege of getting to meet and be a part of all of your work groups. But it's going to be tough. I appreciate everybody who shared all of the great work and what we see ahead. Can we move on to the next topic, Lindsay? Okay, so we're going to have system updates, and we're going to welcome back Megan Cluth and Chavis. Chavis will be doing a review of our where we stand in our strategic plan and how it's being monitored, because we talk a lot about our strategic plan, but if you as members don't understand how it's being monitored and where we're looking at it along this continuum, then what is the point of the strategic plan? So I'm going to quit talking and turn it over to Megan and Chavis.
All right, thanks again for having us. So actually, Melissa, I think this might be you. Do you want to highlight these pieces?
Yeah. The first one, they're just reminders from our last meeting, and it's just the ASQ request. Remember that there's just a survey monkey out there to gather data, and obviously we had a couple conversations about ASQ, so everybody's anxious to learn more about ASQ. Reminder that there is the Kansas Home Visiting Conference. I know that registration was by July 31st. If you are still interested as a home visitor of attending, please reach out to Holly Fry. And if you have not, if you've not attended or not registered, so that you can attend. And then just a reminder that Sunbucks are still there as we wind down the summer to help families. And then we'll go to the next slide, Megan, and we'll get you in there.
Perfect. Well, I'm going to be really quick so that Chavis can have most of our time. These are just reminders that I shared last time, but they're just some upcoming deadlines. So I wanted to make sure people have these resources on their radar. As I mentioned for the work group, invites have gone out for this early childhood mental health group. I know a few of you reached out after the July meeting asking to be included. So we're kind of intentionally crafting an invite list. If anybody on this group really wants to attend, let me know. We can certainly add you. There's been a lot of interest, and we have a little bit of a limited space issue. So let me know if you have not already reached out and are hoping to attend that. But chances are, if you're connected to early childhood mental health, hopefully your partners have already received that invite list, and that'll be in Topeka. And then the child care zones, just as a reminder, this is a grant opportunity through the preschool development grant that KDHE is leading. It's an opportunity for a minimum of 2 counties to come together and really say we think these are the biggest child care needs in our community. and here's how we want to address them. So this time it's a 1-year grant. It's due August 25th. There's more information available on allinforkansaskids.org. I'm also happy to chat with anybody if you're interested in that. Next slide. And then I wanted to note, I shared about this last time, but on Monday of next week, the health insurance support program will open again for childcare professionals. So this is for any Kansas childcare professional. There's a slight preference given to family childcare providers, but certainly we have been able to support a lot of center-based providers as well. So we are hoping later today able to get the materials up on the allinforkansaskids.org site so people can know it's a pretty simple application process. And this is for people who have access to health insurance and are looking to have some help get that costs covered, as well as people who have not had health insurance. We have a few people that have been able to get health insurance for the first time in their life through this program, which is really amazing. And there's also support for anybody who wants to do one-on-one learning more about the marketplace. All of that's available at no cost for any childcare professional in Kansas. So again, more information will be available on All In for Kansas Kids in the next couple days. But I think those applications will last time they filled up pretty fast, as you might imagine. So if you work directly with childcare providers and this might be of interest to you and you want to share it, please keep an eye on that website or feel free to reach out to me and I can send you an email once everything's live. We appreciate your help. We really want this to be a statewide program. So if you can help spread the word, that would be great. And with that, I'm going to hand it to Chavis Armstrong from your team.
Thank you, Megan. Good morning, everyone. My name is Chavis Armstrong. I also work for the Center for Public Partnerships and Research at the University of Kansas. So today I'd like to share with you all some updates on work we're doing to build out strategic plan monitoring. This is a new initiative that aims to measure progress and to ensure accountability to the All In for Kansas Kids strategic plan. This initiative began in May, and since then, we've made a lot of progress. We've identified some key goals for this work, a strategy for how we aim to achieve those goals, and we've begun to build some collaborative relationships that will be critical for accomplishing our goals. So today I'll review the goals and strategy with you, provide examples of our collaboration with Kansas-based teams, and I'll share a preview of our dashboard and timeline. So goal one, or our first key goal for the strategic plan initiative, is to establish a robust system for accountability to the overall vision and plan for early childhood in Kansas. The second key goal, which has me feeling particularly excited, is to shift from individual accountability, where every organization is collecting and utilizing their own data in a silo, to shared accountability. And this is going to involve building habits around sharing and actively using the data that we already possess across the system. So through the strategic plan monitoring initiative, we aim to achieve these goals by capitalizing on the data and stories that already exist, by bringing them together in one space to serve as indicators of progress. So what does that look like? You can go to the next slide. This table attempts to show you our strategy in action. This work is iterative, so I really do look forward to working with you all in this group to streamline it. But our vision for now is that when organizations share their data with us, we can group those data points by their influence on specific strategic plan actions or goals, like you see happening in column 1. Then when we establish that relationship where those organizations are regularly sharing those data points with us, we can begin to assess how their projects or interventions drive change over time. And these observations become indicators of progress towards meeting the goals in the strategic plan. When we have multiple indicators showing change, we can then begin to interpret how the collective actions of our early childhood system help us achieve goals like connecting families to the right services at the right time. As I said before, you can go to the next slide. As I said before, Our goal is to shift from individual accountability to shared accountability by creating habits that around utilizing and sharing existing data across the early childhood system. So to achieve this, we need to engage with organizations and work groups that are implementing programs and services aligned with our strategic plan goals. By doing so, that engagement and that collaboration with those organizations can help us develop those indicators from data across the system, as I described in the last slide. But we want this to be a reciprocal relationship. So through this engagement, we can also help organizations recognize their contributions to the strategic plan and share their stories in an impactful way. So on this slide, you'll see some examples of the collaborative work we've engaged in so far. We've been conducting interviews with early adopters of the new Kansas core competencies for early childhood care and education professionals. And the aim of these interviews is to tell a compelling story about how these new core competencies are being implemented across the entire early childhood ecosystem. This project or this progress that we aim to show through this storytelling will be featured under Goal 2 of the Early Childhood Workforce and Environments pillar, focusing on building workforce capacity for high quality services. We're also collaborating with the Kansas Children's Service League for more in-depth data regarding 1-800-CHILDREN use since 2022. And the goal of this collaboration is to show progress over time for Goal 2 of the ecosystem pillar, specifically to connecting families to the right services at the right time. So these are just a few examples. We really are doing a lot of outreach, and we really want to talk to anyone and everyone that we can. So I want to emphasize that we are available to meet with any group or organization that would like to align their projects and data collection to the goals and actions in the strategic plan. And I've even heard some of you reference already how as you've gotten more familiar with the strategic plan, you can really see your work in it. So let's connect sometime and talk about that more. You can go to the next, thank you. So you're probably wondering where all of this work will live. Again, this is all about shared accountability. So we don't want to engage in this level of data sharing, analysis, and interpretation without sharing what we're learning with everyone in the early childhood ecosystem. So we're developing a dashboard that will share evidence of progress and highlight individual organizations' stories in a user-friendly way. We're going to use a platform called My Sidewalk, and we chose that platform because many communities have used it to achieve similar goals that we have, but for their own strategic plans. For example, there are several communities that use My Sidewalk to show progress towards their community health improvement plans. We feel confident from seeing those examples that it has all the features we need to help us tell the story of how players across the entire early childhood ecosystem in Kansas are moving the needle. We imagine that when this dashboard is operational and even before, organizations can, well, not before, excuse me, I'm jumping ahead a little bit in my thinking, but when it's fully operational, we want organizations to be able to go to it, download data visualizations, stories, and resources that help them make decisions about or make the case for the work that they're doing. So let's go to the timeline and I'll share a little bit about, our vision for how this work is going to roll out. We aim to launch the dashboard and make it accessible to a wide audience by the end of this year. We are well into the installation phase of this project, and in the next couple of months, we hope to deploy a prototype of the dashboard to a select audience, which will include members of this group. So what I hope to leave you all with today is some excitement and anticipation around this work. Listening to the overviews of all of the work groups, I think there's opportunity for this work to play a role in all of the work that's done in each of the individual work groups. I see significant overlap across the board. As I mentioned earlier, we are still building relationships with organizations and could use your help to do so. We're also really excited to get your feedback on the dashboard as it develops. So I thank you for your time. We can't wait to work with you all to make these efforts possible. I kind of went through this quickly, and so I will leave, or Melissa has my contact information, and I can leave my email in the chat. Please feel free to reach out anytime, or find me through Melissa. I really appreciate your time today.
Thank you, Chavis, because again, data is important. If we aren't monitoring our footprints, then we won't know if we made an impact. So I always love when Chavis starts talking about our responsibility to monitor the plan, and making sure that we're making efforts is just as much as if we tried something and it didn't work out, that is just as important to know. So Chavis is our friend, and we can't wait to have her come on more and be a part of our work groups. Okay, and now we will turn it over to the well-being pathway with Megan Chizik and Dr. Byers, who will be giving us an overview of their hard work, and should leave everybody feeling just happy afterwards. So I'm really excited to hear about the pathway.
Thanks, Melissa. Hi, everybody. I'm Megan Chizik. I'm with KU Center for Public Partnerships and Research. Kayla, do you want to say hello?
Hi all, Kayla Byers, and I'm with Florida State University and also affiliated with the KU Center for Public Partnerships and Research. So happy to be here with you today.
We are very excited to share an update with you all, and we'll give those new members and folks who are unfamiliar with this work an overview of the Wellbeing Pathway, which is a new resource for our communities across the state to address specific factors contributing to the well-being of children and families. Next slide. Oh, you're already there. Sorry. So this is we're going to kind of walk you through the pathway, demonstrate kind of how it works, show you basically a sneak peek of the pathway that is not yet live. But many of you were with us over the last couple of years as we were seeking your input on helping us understand what well-being means to you and to your communities and the people that you work with. And we want to kind of walk through what it looks like at this stage and give you an update on the plan, and also invite you to provide some additional feedback. So next slide. So as I mentioned, this is a new resource. This is a tool that uses a strengths-based approach. So we'll kind of walk through that, and you'll be able to see the strengths-based way of looking at this. This is basically a data-driven tool that will give you kind of a snapshot at the county level of how communities are doing in terms of providing well-being to their communities. And I say strengths-based because we were very intentional on taking an approach that did not use risk or deficit language or data. So we aggregated data into an index, and we'll show that to you. But essentially, it takes a number of indicators of publicly available data into a data analysis and algorithm. I'm not, Sushmita is here and she can speak to that from our team if you have very specific questions on how we developed the index, but it helps give a snapshot of what the well-being for different indicators across 6 dimensions looks like. So instead of saying things like, X number of children are living in poverty, we're looking at how many children are not, and how many children are faring well. And so it's just a little bit of a different spin and approach that kind of makes you feel like you're working towards something instead of working backward. So I hope that makes sense, and we'll be able to show you that in action.
Megan, I just wanted to jump in and add one more piece, which is in addition to being strengths-based and data-driven, it's also family-driven and community-driven, and that the dimensions that we're measuring of well-being were defined by the community, by families. This is what well-being includes. So this is a really new way of looking at it and really trying to center those perspectives.
Yes, you bet. Yes. And so alongside the data, we also provide some examples of how you can take action and how other communities have taken action toward improving well-being in different indicators and different dimensions of well-being. We are also highlighting some bright spots from Kansas specifically, as well as other states, as we find kind of things that we think are we want to elevate and share with you all. This is rooted in the Thriving Families, Safer Children vision, and it aligns with our All In for Kansas Kids plan. So, next slide. So as Kayla mentioned, we asked Kansans, we asked you all, many of you were with us when our team came and said, what does well-being mean to you? What does family well-being look like? What does child well-being look like? What does community well-being look like? And we also worked with several other statewide groups and some lived experts in different sectors to help inform that the development of our index and what those dimensions and indicators ended up being. This is a snapshot from the website itself. So once that goes live, you'll see this, and you'll see this sort of as a landing page that gives you a sense of what this is. The pathway across Kansas is we're going to look at data, we're going to explore new ideas, and then you have those ideas that can help you and your community, your organization, take action. And this was funded through the Children's Cabinet, and we're very excited to share what this looks like with you. So let's jump in. Struggling. Okay. So once you get to that page, you just saw the previous slide, then you scroll down and you'll see you have the option to choose a county. And then it also gives you sort of an overview of how the data was measured and how the index and scale was developed. You can click on the highlighted data, indicators, and methodology that will give you very detailed methodology that you can download. It gives you sort of an overview of what you're going to find here. So next slide. So this is our scale. This gives you an idea of what we're looking at. Our 6 dimensions are family and household, community, environment, health, education, and financial. And so within each of these, we look at them individually. So there's no sort of comprehensive well-being score. There's only scores at the dimension and indicator level, and we'll show you that. But this gives you an idea kind of where you're at. So you can note that this is not a low, medium, or high. This isn't you're amazing or you're not. This is a recognition that we are all at different phases of taking action and different steps that we can take to improve well-being. So it's not meant to at all feel like, oh, I'm only getting started. That's great. Let's get started. It's and trying to give people sort of a measure of where you're at and what you can work toward. And then also noting that excelling does not mean achieving. Like we're never done working toward well-being. And so that there's always ways to improve. So this is just a snapshot again of the website that an overview of the individual well-beings when you land on the page. And then when you click on a county, you will come to the next slide. That gives you, and this is our example county, Barton County. And so you'll get a little snapshot of demographics. You'll see how many people live in the community, as well as children under 6, as we are early childhood centric here, and the median household income and what kind of county we're looking at. And then once you scroll down, you'll be able to see this is an example of what it would look like initially. So you would see a snapshot now with it indicating the kind of where they're at, where each individual county is at in terms of their well-being. So it gives you that little snapshot, and then you can click on one. So let's pretend to click on health. So it'll send you to the next page, and it'll give you kind of an overview again at the county level. Your health dimension in Barton County, it gives you a description. It gives you just a quick overview of the indicators that fall within this dimension, and then the score. And then you can start to kind of piece through each of those indicators that kind of fall down on the screen. So the first one being access to healthcare resources. And I'll just orient you to this page here. So you can see again, kind of the excelling at the top, the description of what the indicator includes, and then the score. And then the sort of white box below where it says take action are some examples of things that communities, organizations, and decision makers can do. So kind of thinking about the different audiences and folks that might use this tool or take a look at it, that gives you some ideas on what other communities have been doing and the action steps you could take with live links to those resources. And then you'll see like the little eye at the bottom where it says, how do we measure this? That you'll be able to click on that. It'll be a little hover box that'll tell you where the publicly available data sources came from that contributed to those indicators. And the next one, we've got healthy behaviors. So again, kind of looking at the things that reduce risk and promote long-term well-being, like physical activity, sufficient sleep, substance use avoidance, and self-care habits. And again, you can kind of see the strengths-based language that we're using here. Mental health status is another indicator as an example, and you can see the different resources. Again, you can see that we've organized them by different levels of audiences. And then preventative screenings. You can see where we're adding in things that may look familiar to you, like Help Me Grow. And then the last one in this category is the physical health status. And in some places where it made sense for us to directly tie it to the All In for Kansas Kids plan, you can see that in this example. And then the last thing on this particular page when you're on the website is highlighting some bright spots. So some very specific work that's happening in Kansas that we want to lift up and demonstrate where, much like the Take Action, it's very similar, but we want to collect these bright spots and share those. And so you can see where there will be a place where you can also submit your own bright spot. And we are still in need of bright spots for all of these different dimensions. And so that's going to be our ask of you at the end of this conversation. But we'll have highlights for bright spots in each dimension. And I want to note, in case folks have questions, that at this time, the Take Action steps and the bright spots are the same for every county. But we are diversifying the kinds of action steps and bright spots as much as we can to reach different kinds of communities and different levels of kind of where you're at in the well-being process. And then just sort of at the bottom, you can kind of see a little on the previous slide there. Yeah. Oh, you can't see that. There's a place where you can also explore additional counties. So it's just a quick link to additional dimensions there. So that's kind of a walkthrough of that. And we have asked you all before, for those of you that are familiar, we've had a call for bright spots. And maybe Ella, if you could did you already drop that? I'm not like on top of my thank you. So Ella just dropped a link to our Bright Spot survey that we are collecting. So if you are thinking, hey, I want to lift up this bright spot in my community that might appeal to different organizations, communities, decision makers, policymakers, legislators, individuals, whomever is working toward building well-being that could learn from this bright spot, we really would love to hear from you. So please feel free to use that link anytime. We're going to have a link to that, as you saw on the website itself. And it's a place where we're still exploring what does it look like to share those out. And we envision some way of making sure those bright spots get elevated and shared with everyone as they come into us, and not just the handful that are on that little box right now. Our plan is to officially launch this website publicly in September. We are going to be presenting a walkthrough of the website, much like this. So you're getting a sneak peek. We'll be sharing this at the All In for Kansas Kids webinar in September, so more folks can get an additional sneak peek. And depending on kind of troubleshooting and technology, we plan to launch that shortly thereafter. We want to make sure we work through any remaining bugs and such on the site, but it's almost ready to launch for everyone to start using. And we're going to definitely want to hear from you all on your bright spots, how you envision using this tool, how you're using it, or things that you would like to see improved or changed or added as we iterate with the tool for over the next year or so. Questions?
Well, if there's any questions spurred later on, Megan, we will definitely connect as we know how to reach you. This is just a feel-good way for a community to focus on where they're at and understand. So really love, I mean, you guys were very thoughtful, even down to the color scheme, to make sure this was a strengths-based tool, and truly appreciate all of the work that you guys have put into this. And I hope everybody utilizes the tool, and when it goes live and continues, because correct me if I'm wrong, Megan and Kayla, it's a living tool, right? So those bright spots can evolve. I mean, and
You
it
bet.
should evolve. So
Yes.
this will not be the last ask of, because communities are doing great things every day, and things change and new initiatives. So you want this to be a repository of ideas that move forward. So will not be the last ask.
Definitely not. And the data will be updated as there is updated data metrics. You'll be able to see the progress in a community over time. And the hope is that this gives enough of the true drill down detail for us to see a root cause, to understand, you might be doing pretty well in health, but there's one area in a community that could be shored up. And, rather than casting around in the dark, now we know, and we have an idea from our neighboring community of how they tackled that. So that's really the hope.
Great. We do have one question. So Desiree, if you would introduce yourself and then come off mute.
Desiree Straight. I'm a family childcare provider in Kingman. And I was just curious what tool you have to inform people that this tool is available. Like, is there some flyers that we're sharing? Is there an email going out? I know in my area that's always important, of how can we encourage our communities to utilize this?
Yeah, great question. All of those things will be available when it goes live. So we are working on developing something that can be email distributed. An email will go out to the whole All In for Kansas Kids listserv, but also individually, we could send something that could be emailed or shared widely. We'll also be posting links to it. This will live on the Children's Cabinet website. So there will be kind of a highlight and kind of, I don't know if it'll be a press release as much as like, hey, this is here. Maybe it'll be a press release. I don't know. But something to denote, hey, this is new. This is here. Click here. So that could be easily shareable as well. So yeah, absolutely. We will be widely promoting it when it's ready.
And we will definitely share this all out with the panel members too, as a different, just as we have a lovely listserv. So good question, Desiree. All right, without seeing any additional questions, I just want to thank Kayla and Megan for joining us this morning to talk about feel-good data. So really appreciate and cannot wait for the launch and the additional webinar to learn more.
Thank you.
All right, thank you. So as we work towards our closing, as we promised, part of the systems communications team is to, there's some thought-provoking key takeaways. So I put my key takeaways from today is to look for early childhood opportunities as they exist around every corner and are critical for community growth and sustainability. And they don't have to be our normal what we think of as in the early childhood ecosystem. So for me, it was really looking at Coffeyville as a prime example of asking pertinent questions to get involved and to really continue to lift up initiatives that may not have started as an early childhood idea, but early childhood is always going to be a component of that. And then also thinking about the pediatric data and really understanding who is meeting the healthcare needs of Kansas children, and really trying to understand that and what actions are needed to ensure that the Kansas vision, the blueprint vision that every child thrives is met. So those were some of my key takeaways as I was putting together the presentation. And so I really want you to think about your key takeaways and what you can do with the information that we heard from Chavis in monitoring and, any of the initiatives that Megan shared as the system and definitely the well-being pathway and how you will utilize those resources in your own community. And taking a page from the well-being pathway bright spots. Again, if you have not recognized, I'm a very visual person. I wanted to create our own bright spots. I have seen enough and been enough on these meetings where we say, hey, does anybody have a bright spot to share? And it's just a pregnant pause. So what I really wanted to do is pull in bright spots so everybody can see them. And if you're a panel member and I see you somewhere on some social media spot, I'm going to include that. And so really wanted to see how it was a continuum of care and bright spots. So let's start with in Wichita. We had two panel members, April and Mandy, and it's specifically April, who was honored for her work in serving military families. And so really wanted to give a shout out to April. And then, yesterday was August 14th, and Dolly Parton in our Imagination Library had it at Kansas State. And if anybody, well, you will soon get to know me. I love Dolly Parton, so that I now work in a space that has the Imagination Library, totally amazing. So love that we are getting books in the hands of children. And then most recently, Maternal and Child Health Prevention had their Million Moments conference in Kansas City, and saw all, panel members and agency partners coming together to really celebrate and learn more on how to support children and families and mothers. And then our panel member, Heather Faulkner, was named the director of the new Reno County Child Care Nonprofit Kids Collective, which she shared, and she didn't know that she was going to be highlighted on the Bright Moments. So love that we were able to pull that down. And Desiree Strait, another panel member, is also an intimate part of the Zones grant that Megan Cluth shared during our systems initiative. Want to know where they got the big check from? Love the visual that they had attached to that. But they are serving 5 Southwest Kansas counties, and really also wanted Desiree to be a part of our panel so much that their zone group is supporting her so that she could be in our monthly meetings. So love the bright spot there. Also, as I shared, I was yesterday in the Manhattan Area Chamber of Commerce, and that's the outside of the building, which is just beautiful. And then loved the inside, the incubator spots. What I loved most about the incubator spots is you will notice all of the natural lighting. Would love to see, as Megan was talking about the mental health supports, how much that impact has on staff and children, just to have that natural lighting and be able to connect with the outside and have that be a part of their indoor space. And also in the middle is the Help Me Grow group, who traveled to a conference and brought back some of their initiatives. When I say we are a state that sets standards, I recently had an opportunity to meet with some of the Help Me Grow group and got really excited for their initiatives, and especially their books, balls, and block development initiative. So we're going to drop that in, because what I really hope with these connections is that you as community members are able to host some of these events that are being funded across the state and really connect families to these initiatives. So Help Me Grow is a great program that meets families where they're at, and hopes to fill in those gaps. And so hopefully you will be able to take advantage of those initiatives. And then we had a press release this week where the governor, Governor Kelly, announced the Office of Early Childhood had an implementation team and a leader moving forward that charge in Zach Vincent from her office. So lots of great things coming through Kansas. And if you haven't, encourage you to also sign up for the governor's newsletters and press releases, and you would have gotten right hot off the press, and then you'll see all of the members of the implementation team. And also, if you haven't, also encourage you to stream or at least go look at the slides from the Children's Cabinet meeting. You'll see in August the Children's Cabinet themselves. We are also under a governance board and welcome new cabinet members. That the Office of Early Childhood bill, House Bill 2045, required new slots to be filled, and those slots were filled in August. But the best part of that meeting was talking about the CBCAP. If you're not familiar with the CBCAP, it's the Community-Based Child Abuse Prevention federal funding that goes out to communities to enhance programs aimed at preventing child abuse and supports families with primary and secondary prevention. And these were the slates for this fiscal year, and the recommended funding that was approved by the committee. So lots of things going on in our system that support families. So really wanted to call that in, and I will continue to do this and troll and pull photos. So if you're caught in a photo, you will I will find it, because I'm really good at that. But I really wanted to highlight in a very visual way the bright spots that are going on in Kansas. So with that being said, next slide, Lindsay. We are done for the day, but wanted to remind you of our meeting schedule. We will be meeting on September 19th. And then before that, or after that, there's also going to be the Children's Cabinet and Trust Fund cabinet meeting, which is live streamed on October 3rd. So hopeful we'll see everybody again in September. Complete your assignment, which includes your survey, because Lindsay and I will be working on work group assignments beforehand, and have a great rest of your day and enjoy this lovely weekend as we wind down summer. All right. Thank everybody for joining today.